Hi, my name is Carly Leatherman, and I am an occupational therapy student at the University of Alabama at Birmingham. And in this module, I'll be discussing food and mealtime related behaviors and conditions and how they stem from a history of trauma. The goal of this module is to help caregivers of children with histories of trauma understand the impact trauma and unmet needs can have on feeding and mealtime behaviors, and why these children in care are at an increased risk for eating disorders and other mealtime related conditions. This module is split into two parts, and in the first part, we'll be discussing how trauma can impact general and mealtime behaviors, and I will provide some strategies. The link between challenging childhood experiences and the emergence of eating disorders or problematic mealtime behaviors can be impacted by various factors such as emotional challenges, feelings of abandonment, mistrust, anxiety, and self-esteem issues. These issues are especially visible in children who have experienced adverse childhood experiences, or ACEs. ACEs refer to traumatic events or adverse situations that children may encounter during their upbringing. These experiences can have a lasting impact on a child's physical, emotional, and psychological well-being. ACEs typically include various forms of abuse, such as physical, emotional, or sexual abuse, neglect, household dysfunction, such as substance abuse, mental illness, or domestic violence. It can also include other stressful events like divorce or the incarceration of a family member. Children with histories of multiple ACEs often display symptoms like eating too quickly, never feeling satisfied, maybe hoarding food, or losing their appetite. These symptoms can lead to additional mental health challenges stemming from the trauma they've endured. It's important to understand how a child's early relationship with food can be affected. When a child isn't consistently and predictably fed by their primary caregiver, they may develop food insecurity. Children in foster care may use food as a way to sort of regain a sense of control in their lives. It can also serve as a source of comfort during times of distress, or it may be a survival instinct. The loss of a caregiver, even at a very young age, can have a lasting impact. It can teach a developing mind that caregivers might suddenly disappear, or they may not always be relied upon to meet their child's basic needs. Children with insecure attachments are more likely than securely attached children to regulate their emotions by overeating, and this can result in your child developing a strong focus on food, or using it for comfort, or even displaying behaviors related to survival, like hoarding, stealing, or eating non-food items. The impact of trauma on a child's behavior is multifaceted and can manifest in various ways. Children with trauma may struggle to identify or engage in healthy activities that promote emotional well-being and a sense of internal regulation within their chronically dysregulated bodies. They may instead engage in behaviors that provide immediate and heightened pleasure, such as substance abuse, emotional eating, in search of that instant gratification. Others may resort to active avoidance strategies as a means of coping with their interoceptive discomfort, which can lead to self-injurious behaviors. The impact of trauma on behavior may lead to diminished self-control and increased food intake, particularly when experiencing negative emotions. Studies have shown that mood states and interoception plays a significant role in risk-taking and impulsivity in response to trauma. Trauma can disrupt the integrity of the cerebral cortex, affecting the frontal lobe, which impairs executive functioning, which is the set of mental skills that include working memory, flexible thinking, and self-control. Trauma may also affect reasoning abilities differently. Children with a history of neglect often experience impairments in working memory, fluid reasoning skills, and processing speed, and have higher levels of anxiety, dysregulation, and limitations in inhibition and self-monitoring. On the other hand, individuals who've experienced physical, sexual, or emotional abuse may show differences in their prefrontal cortex and amygdala connectivity, which means they're more likely to display externalizing behaviors such as yelling, aggression, or disruptive behaviors than those who have experienced neglect, who may be more withdrawn. Co-regulation is important to help these children regulate their brains to navigate the challenges associated with trauma. Various factors may impact a child's behavior. For example, the child's unique skills, comprehension abilities, and communication skills, along with parenting style, family values, and the context of mealtimes. Behaviors are often an expression of an unmet need, Behaviors arising from trauma can include passive behaviors like noncompliance, withdrawal, avoidance, inattention, or lack of responding. While not overly disruptive, this can still significantly impair a child's occupational performance and participation in daily activities, which often leads to frustration for the caregivers. On the other hand, active behaviors such as direct refusal, opposition, aggression towards people or property, or self-injurious actions not only hinder their occupational functioning, but can also disrupt the child's environment and potentially pose harm to themselves or others. In many everyday situations, challenging behavior can be seen as inconvenient and irritating for those in the child's surroundings. To address these behaviors, it's essential to determine their underlying purpose. Is your child overwhelmed by choices or sensory stimuli, or are they experiencing pain? Do they possess the necessary communication and language skills to express their needs, especially in cases involving children with a history of neglect or maybe authoritarian upbringing, such as those in foster care? Most challenging behaviors are reactive, and the child may not have insight into their underlying motivations or purposes behind those actions. Children who struggle with processing and integrating sensory information may experience heightened arousal and hyperresponsivity, which can contribute to challenging behaviors. Certain events or triggers may not immediately cause the challenging behavior, but it can be a factor when combined with other triggers. Some examples of setting events can include maybe your child has overslept. Is there an illness, disruption in their daily schedule? Are they feeling conflicts, anxiety, fatigue, hunger, pain? Do they have poor emotional regulation? Or are they in a new, unfamiliar place? In children who face adversity, such as children in foster care, they often come from unpredictable and disorganized backgrounds. They often seek to control their environment in the only way they can, which is typically expressed through behaviors like meltdowns, yelling, or other challenging behaviors. Behaviors serve as a form of communication, often indicating an unmet or underlying need. For example, a child who's learned that their voice isn't important or their needs are not going to be met, they are forced to find other ways to fulfill those needs, which are often then labeled as challenging behaviors. It's important to understand what your child is really saying and what do they actually need. So addressing these behaviors are necessary, but they also must be addressed with both sensitivity and responsiveness in order to prevent re-traumatization. It's also important to promote felt safety, build trust and connection, and build their emotional regulation. Eating and feeding is an emotional, social, and sensory complex activity. This can be especially challenging for children who've experienced trauma, such as children in foster care. First, we will discuss some general strategies to establish connection and safety and setting up your child and you to be successful. So first, create a safe, consistent, and supportive environment. Ensure that meal times are calm and free of stress or conflict. Provide a comfortable and safe seating arrangement for the child. Maintain a consistent mealtime routine with set schedules, as predictability can help reduce anxiety and improve a child's willingness to participate in mealtimes. Have them sit in the same table, at the same seat, with the same placemat. This signals it's time to eat. Also, make it fun. Play allows children to explore and engage with various sensory stimuli such as touch, movement, sound, visual input. Through play, they can learn to process these sensory inputs, helping them regulate their responses and develop appropriate reactions. Engaging the senses can help children get used to the food. So allow them to be silly and playful, but there's a big difference between playing with and throwing food versus food play and exploration. An example of play and exploring food, you can try providing a carrot and a bell pepper and ask, which one do you think is going to crunch louder? If play becomes too much of a problem that they won't eat their meals or that their meals are lasting over 30 minutes, set aside a time between meals that they can explore and play with food. Lastly, shift the focus. So instead of concentrating on what the child is eating, make the conversation about them. Discuss your child's day, their interests, and encourage them to talk about themselves. Mealtime can be a valuable opportunity to connect and learn more about your child. So avoid pressuring the child to eat and instead encourage exploration and acceptance of the food. So avoid saying, great job, you ate it, but instead focus on maybe the properties of the food, like was it sour or sweet, or did it taste like what you were expecting? Proactive strategies aim to prevent or minimize challenges before they occur. So first, I'll discuss some general proactive strategies, and then I'll give some more specific examples to use for specific unmet needs. But first, emotional regulation. Many children who've experienced maltreatment or neglect often do not receive adequate physical regulation from maybe nurturing caregivers, which can lead to challenges in developing self-regulation skills, both in terms of physical and emotional aspects. So your job is to help your child learn and practice different ways to express their emotions constructively. Avoid telling them what emotional state you think they are in, but instead guide them with options and talking through it. You can use a verbal name and match it to a body cue. For example, I see your hands are clenched tight and your voice has gotten lower and louder. I wonder what is going on for you. Also, help your child develop healthier ways to cope with emotions and stress and boredom. Encourage them to express their feelings and provide alternate activities for distraction and emotional regulation. Try activities like physical activities such as walking, swinging, riding a bike, or jumping on a trampoline, which all can be calming and organizing. Or try doing a hobby such as a puzzle or playing with a fidget toy, listening to music, or dancing. Here's a list of more ideas. Create a structured, predictable routine. Predictable meal times and snack times every 2 to 3 hours can help reduce anxiety around food and can create a sense of security. You can provide support for transitions using timers, visual schedules, representational objects, and verbal warnings. Many foster children may find transitions challenging, so by providing personalized support during transitions, like using these timer schedules or objects, which can help ease the process and reduce anxiety. Timers, especially visual timers, can be a useful tool in establishing a sense of structure and predictability. Setting a timer for a specific duration can be used for various activities and transitions, such as helping a child transition from one activity to another, or to help your child visualize when dinner will be ready or when it's time to start the bedtime routine. Time is a very abstract concept, and kids often do better being able to see it, so I recommend either using maybe stand timers or they have visual timer apps. You can also make visual schedules, either in the form of visual charts or written plans, which can outline the sequence of activities. These visual aids provide a clear map of what to expect and can help reduce their anxiety. You can also introduce a representational object, which can be used to signal mealtime. For instance, having a special placemat that is only used during meals can signal to the child that it's time to eat. Foster children, especially those with a history of trauma, may be sensitive to abrupt transitions or commands. So instead of announcing it's time to eat, you can provide a verbal warning or a preemptive statement to prepare them for the upcoming activity. For example, we will be eating in 5 minutes. It's time to wash your hands. This approach allows the child to mentally transition into the mealtime activity. You can also use first, then statements, which are a simple but effective way to structure transition expectations. For example, you can say, first we will wash our hands and then we will eat. This approach provides clear sequential instructions and helps the child understand the order of activities. Engage in family meals and model appropriate behaviors. Family meal times create a supportive environment where children can develop healthy eating habits, learn about proper nutrition, and establish positive social interactions. Modeling eating behaviors demonstrates that not only the food is safe, but can be an example of appropriate eating and social behaviors. So encourage other family members to support your child rather than tease or make fun of their attempts. Even just one caring adult eating with a child can count as a family meal. Just make sure each person at the meal is calm and emotionally regulated. Establish a sensory-friendly environment. So design the child's environment to accommodate their sensory needs. You can provide sensory tools, quiet spaces, adjust lighting, sounds, and textures to suit their preferences. Also, match tasks to the child's developmental and cognitive level, considering their strengths and preferences. This can make tasks more engaging and manageable. For example, break up difficult tasks into smaller, more manageable portions, providing frequent breaks and/or using tools or aids to help as needed. In addition, set reasonable time limits. A typical meal lasts around 15 to 30 minutes, and a snack is typically 10 to 15 minutes. For children who won't sit at the table for an extended period of time, for example, if they stand in their chair or leave the table, gradually increase the time that they spend in their seat. Use positive reinforcement to reward desired behaviors like sitting still. You may start by asking the child to sit in their seat for a short amount of time, like 2 to 3 minutes if their attention span is really short, and then over time gradually increase the amount of time that they need to stay seated. You can use a visual timer so they can visually see how long they need to sit. Also, allow your child to have some say in their daily activities and decisions. Giving them opportunities for choice can help them feel more in control and invested in their routines. So allow them to choose what and how much to eat from the food offered. Offering choices and a sense of control can increase willingness to explore and accept foods. So let your child decide between dinner or side dishes. For example, do you want meatloaf or spaghetti for dinner? Do you want a side of broccoli or carrots? In addition, involve your child in grocery shopping, meal planning, and preparing the food. You can also serve foods family style, so your child can serve themselves and feel in control. You can use a portion control plate to help your child visualize how much food from each food group they should be getting, but don't use this as a limit. Allow multiple servings if appropriate. This can give them a sense of control and ownership over their meals and can start to normalize their food experiences. It's also important to practice appropriate ways to communicate, such as practicing politely asking for what they need and want. For example, if a child wants a snack, they can be encouraged to say, "Can I have a snack, please?" Or "I'd like some water, please?" Or "I need a break, please." Some children may find it easier to express themselves through nonverbal means, especially in heightened states of anxiety or dysregulation. So you can incorporate the use of picture cards, sign language, or gestures to indicate their needs. For example, using a picture card of an apple to request an apple for a snack, or using a red card to signal that they need a break. Lastly, provide consistent child-focused attention throughout the day that's not contingent upon their behavior from earlier in the day. This creates a sense of security and helps build a secure attachment. So spend quality time together, engage in activities they enjoy, and maintain an open communication. Food hoarding and stealing often stems from a history of neglect, insecurity about their access to food, and traumatic experiences related to food scarcity. This uncertainty can lead to a pattern of stockpiling food in secret and can instill a sense of insecurity and fear around food. Children with a history of food insecurity often develop a heightened survival instinct related to food, such as resorting to stealing and hoarding food, begging neighbors for food, or even eating non-food items such as dirt to prevent starvation. This may even persist when food becomes readily available, such as when a child enters foster care. Sometimes children find food as a source of emotional comfort or as a sense of control. They might turn to food when they are feeling anxious, stressed, bored, or sad. Hoarding food can be a way for them to manage their emotions or as a way to feel secure that they won't go hungry. Some common signs to look for include, but are not limited to, finding excessive empty wrappers in pockets or drawers or underneath the bed, noticing that food is disappearing from the fridge, begging for food even right after eating, maybe even eating too quickly when asked to slow down, or being possessive about their food and getting upset if someone eats off their plate. Here are some strategies that I do and don't recommend. So do provide reassurance and be compassionate. Reassure them that they won't go hungry and that they are safe. Hoarding and stealing may have been conceptualized as logical behaviors in order to avoid starving. So approach this issue with compassion and avoid harsh punishments. Acknowledge their past experiences and their need for security. Do establish regular meals and routines. Predictable meal times and snack times every 2 to 3 hours can help reduce anxiety around food and create a sense of security. Create a visual schedule and a menu so they know what to eat, what they're going to eat, and when they're going to eat it. Do provide an anytime bowl of fruits and healthy snacks. Having an anytime bowl of healthy snacks readily available helps foster children feel secure and assured that food is accessible whenever they need it. An anytime bowl can reduce anxiety around food scarcity, which is a common trigger for hoarding behaviors. It encourages regular eating patterns, which can help normalize mealtime habits. Children can learn that food is consistently available, which can promote healthier and more structured eating routines. In the beginning, they may take frequently from the bowl, but over time, when they see it will always be stocked, they won't feel the need to take from it excessively. In addition, allow your child to help pick what healthy foods will be available in this bowl. You can also designate a drawer in the fridge for anytime access. So you can provide options of snacks such as granola bars, dried fruit, or even fresh fruits and vegetables. Communicate with your child what options they would like while avoiding processed foods they will likely overindulge in. Typically, children won't overindulge or overeat in healthy foods. And if they do, that's good to know because that would be something you'd want to follow up with their doctor about. You can also try providing your child with their own cupboard space in the kitchen that is strictly for them. So not allowing them unrestricted access, but letting them pick out a snack at designated times. This ensures that they have food and no one else is allowed to take it. Reassure the child that it's their cupboard and it will always be full. Or a different option is to provide a bag of snacks every day with their name on it. Fill it every morning with a rotating group of healthy options that they can carry with them and eat whenever they want. If they eat it all, make sure that they still have access to fruits and vegetables at any time, but reassure them that you will refill their bag in the morning. So here are some don'ts. Don't restrict. Oftentimes, restricting food intake can be re-traumatizing and can be a trigger for past food experiences. You may think it's more logical to restrict the amount of food a child has access to, but restriction tends to lead to further stress. An anxious, stressed, food hoarding foster child is likely to want to eat more and go to more extreme measures to get food. So instead, you want to offer occasional processed foods at snack time or as a balanced meal. Again, provide them a choice of which snack that they would like. And lastly, don't put locks on the cabinets or the fridge and avoid shaming the behaviors as it can trigger trauma experiences and may exacerbate the stealing. The act of hoarding and stealing food items stems from a sense of scarcity and the fear of not having enough to eat, which the child likely developed during a period of food insecurity. Locking cabinets may temporarily prevent the behavior, but it doesn't address the root cause of the child's anxiety and insecurity about food. The answer is to make food more available and not less available. Children in foster care may display picky eating behaviors due to a history of limited access to healthy foods, due to heightened sensory experiences around food, or due to a history of negative mealtime experiences. There are many reasons why a child won't eat, a common myth being that if a child is hungry enough, they will eat and they will not starve themselves. However, if eating is challenging or painful to a child, or if they have a history of negative experiences when eating, no amount of hunger will overcome that. Instead, their appetite often becomes suppressed so that they no longer respond correctly to hunger cues. It's important not to assume that your child is just a picky eater or that they are just being challenging. If you listen to Module 3, I mentioned that eating is the most sensory-involved practice that we engage in. It involves sensory experience in all areas, including positioning and how we perceive our body in space, smelling, tasting, seeing the food, and hearing it inside and outside of the mouth. And it includes the interoceptive awareness of feeling hunger and feeling fullness. Children who have histories of trauma are more likely than the general population to have heightened sensitivities to taste, smell, touch, tactile, auditory, or movement, all of which can affect a child's willingness to eat. In addition, weak oral motor skills or gross and fine motor skills can impact a child's physical ability to feed themselves. I recommend listening to Module 3 for more information, or I recommend talking to your child's pediatrician or occupational therapist if you have concerns about your child's ability to eat. A limited exposure to a variety of foods can make children hesitant to try new items. Depending on your child's experiences, they may have had more access to high caloric, non-perishable food items, which can lead to a preference for unhealthy food and anxiety around new foods such as fresh fruits and vegetables. Keep in mind that many children may come to you with very different experiences with food, especially if they're from another country, or come from different racial or cultural backgrounds, or come from a background of neglect or abuse. Being presented with completely new foods can be scary and anxiety-producing for children. Be sure to ask your child about what foods they're used to eating and what they enjoy. Then find a way to make some of those favorites a regular part of their meals. It's important to not shame them for eating foods they're comfortable with, as they may have been a source of safety to them. So avoid using words like junk and instead use neutral words like fast or prepared foods. Here are some strategies I do and don't recommend when it comes to picky eating and other food avoidance behaviors. So do make the meal fun and playful. Engage in sensory exploration, such as asking open-ended questions about the food, such as what it feels like, what colors they see, whether it resembles other foods they've had, and what it smells like. Make meal times enjoyable by using colorful plates, creating fun food faces, or arranging the food in creative ways, such as making a rainbow of fruits and vegetables or arranging food into a funny face. Do offer multiple exposures and repetitions to new foods. It takes approximately 10 to 15 exposures of a new food before a child can begin to accept it. So, provide repeated exposures can help increase familiarity and acceptance. Allow graded, repeated exposure to new foods without pressuring your child to eat. Encourage them to engage with the food by smelling, licking, and tasting, but avoid pressuring to immediately consume it. Do implement a rating system, such as using green as an always like, yellow as sometimes I like, or red I will never like to classify foods. This helps clarify preferences. So discuss with your child how foods can change their rating by trying different preparations or adding seasonings or dips. For example, carrots dipped into ranch or hummus, or adding cheese to broccoli. Do teach polite tasting. Show your child how to discreetly spit out food in a napkin if they're anxious to try it. This can help them feel more at ease about trying new foods. Starting slowly is okay. You can begin by trying a different brand of a favorite food, or by providing a discard plate where they can remove the food they don't want onto the discard plate. In Module 3, I talked more about this, but physically touching food or moving food with a utensil is an early stage of interacting with a new or non-preferred food. Do offer new foods at the beginning of a meal or at snack time. Trying new foods earlier in the meal can help reduce mealtime stress. You can alternate between bites of a new food and bites of preferred food. For example, have them take a single bite of each food on the plate before repeating the food. Do ensure that there are no underlying oral motor or sensory impairments that could hinder their eating. Consult with a healthcare professional if needed. Consider your child's age and developmental stage when selecting foods. So do choose textures and portion sizes that align with their abilities. Here are some of the don'ts. Don't pressure your child to eat, so don't shame them for not eating. If they do try the food, instead of using verbal praises such as, "You tried it, great job," make it less about the eating the food to take the pressure off. So instead, you could say, "Wow, you touched it. How did it feel?" Or, "Was it crunchy or smooth?" In addition, ensure the child feels emotionally supported during mealtimes. Encourage them to express their feelings and fears. Validate their emotions and let them know that it's okay to be anxious or uncertain about food. Coercion can intensify feeding avoidance behaviors. Instead, let them feel in control with their food choices. Don't bribe with desserts or activities. Using food as a bribe or as a punishment can further create an unhealthy relationship with food. Using dessert as a bribe does not address the underlying reasons for picky eating or mealtime challenges. It merely masks the issue temporarily and may not lead to a lasting solution. Instead, offer desserts for a bedtime snack or on the weekends, not contingent upon eating dinner. Here are some reactive strategies. Reactive strategies are implemented in response to a specific situation or behavior. For example, a reactive strategy is to remain calm, so stay calm and composed during challenging behaviors. Avoid escalating the situation by reacting emotionally. The way caregivers respond significantly influences a child's behavior and emotion regulation. Children learn by modeling after the adults in their lives. Therefore, when you practice and demonstrate calm and composed reactions, you are providing your child with a valuable example of emotional regulation. Instead of lecturing, shaming, or scolding, which can re-traumatize your child, offer a chance for a redo in order to correct inappropriate behavior. This approach provides you an opportunity to practice the appropriate response, which will help build motor memory for the correct action. You can also communicate and reflect when you lose your regulation state and make a mistake. In this way, you demonstrate to the child that you are trustworthy to own a mistake and use the same tools that you're trying to teach them to use. It's important to show your child that you care about their needs, but it's also important to teach them how to handle disappointment when the need can't be met in that moment. For example, if your child asks for candy while you're preparing dinner, respond in a kind but firm voice to say, "That is really good asking, but this time I'd like you to practice accepting no." Before your child has a meltdown, respond with an affirming praise such as, "Wow, that's great accepting no." Offer a choice if appropriate, such as you can have a snack of fruits or vegetables now, or you can have candy after dinner. Teach and have children practice using verbal phrases to make a compromise or request something different. For example, a child may encounter food they don't like or don't want for a snack. So encourage your child to practice making a compromise. For instance, they can say, I don't really enjoy carrots. Can I have blank instead? Or if they ask for something unreasonable or not appropriate at the time, allow them to pick from a few options. Providing choices and a say in what they get for a snack can be empowering and can help develop trust. It's also important to provide co-regulation in the moment of a tantrum or outburst. Acknowledge the child's feelings and emotions, showing understanding and empathy. This helps them feel heard and supported, and demonstrate self-regulation techniques and strategies during challenge moments to provide a practical example for them to model. If your child is experiencing dysregulation, don't say, use your strategies that you were taught, because it's already too late. Instead, using co-regulation, participate in coping strategies and activities with your child, such as listening to music together, dancing together, or going on a walk. By being present, you are conveying to your child that you are there and that you can get through this together, rather than leaving them to figure it out alone. Lastly, create a calm down corner. So designate a specific space where the child can retreat to when they're feeling overwhelmed. Equip it with calming and comforting sensory items and tools. It's important to note that this is not a timeout. A caregiver may need to stay with them to co-regulate before they can use it for self-regulation. If you need more specific reactive strategies for specific behaviors, I would recommend a trust-based relational intervention, or TBRI, caregiver training. This is a great place to learn more about reactive strategies in response to a specific need, or you can find a trauma-informed OT to help specifically with reactive strategies that meet the needs of your individual child related to feeding. If your child's tantrums begin to escalate into aggressive behavior, I recommend seeking professional guidance. Aggressive behavior in children can be indicative of underlying emotional or developmental challenges that may require specialized intervention. Consulting with a pediatrician or other healthcare professional, such as an occupational therapist, can provide valuable insights into the root cause of the aggression and offer tailored strategies to address and manage these challenging behaviors. Seek expert help from a pediatrician, an occupational therapist, early intervention specialist, or school evaluators if your child's behavior significantly deviates from typical developmental milestones, or when behaviors significantly interfere or impact their activities of daily living. For example, seek out expert help if you notice your child has persistent behavioral issues that interfere with their daily life, relationships, or learning experiences, or if they have difficulty maintaining relationships or seem to isolate themselves, if they have excessive emotional instability or frequent mood swings that exceeds typical childhood behavior. Also seek out an expert if you notice significant disturbances in sleep or eating patterns, or if you notice over or under reactions to sensory experiences, or difficulties in gross, fine, and oral motor skills, which all can impact eating. If you have any other concerns that I didn't mention, I recommend seeking professional help just to ensure that your child's needs are getting met in a timely and supportive manner.